Galen Hunter,
Here.
Paul McCollum,
Here.
Chuck Peacock,
Here.
Drew Williams, Judge David Hudson, Mayor Sandy Sanders,
Here.
Mike Tanner.
Here.
There's a quorum.
Well, again, as I said, it's an exciting day for the Fort Smith regional area, and we're glad that you chose to join us, and along with our mayors of our two adjoining cities, we're glad that you chose to be with us today. And we have one item on the agenda today, and that's the consideration of a recommendation for the potential land conveyance. And I'm going to recognize our real estate review chairman, Galen Hunter. If you would.
Thank you, Dean. The Real Estate Review Committee met earlier today to consider a land conveyance to the Fort Smith Regional Healthcare Foundation, which is a nonprofit who's seeking to build a new osteopathic school here at Chaffee Crossing. And before we bring our recommendation to the board, I'd like to introduce Tom Webb and Kyle Parker from the Fort Smith Regional Healthcare Foundation and ask them to give an overview of the project that they presented to the Real Estate Review Committee earlier today. Kyle?
I'm the chairman of the Fort Smith Regional Healthcare Foundation. We are a nonprofit private entity, and we have been studying for now more than a year and trying to determine the feasibility of an osteopathic medical school to be located in the Fort Smith and Barling regions. After a lengthy study, not only in the feasibility, therefore the needs of doing that, we determined that in fact that the western Arkansas and eastern Oklahoma regions in our respective states, with our border state, was clearly the most underserved area in the state of Arkansas as well as the state of Oklahoma. The state of Arkansas is currently ranked 48th in physician accessibility for physician services in the United States. And therefore, when you look at the western area of Arkansas, it is clearly the #1 area of the most underserved areas for the state of Arkansas, and as is the eastern portion of the state of Oklahoma. So we looked at that feasibility, and then we made a determination that yes, in fact, we are underserved, and we needed to see if we could do something, because after all, that's the premise of the Fort Smith Regional Healthcare Foundation, is serving the underserved and closing the gap and providing medical needs. We then looked at the financial aspects of doing that and determined what we believe to be the appropriate cost in establishing a medical school. The proposed medical school will enroll 150 students per year for a total of 600 students that will be attending the medical school. We then sought out and tried to determine, do we have sufficient clinical rotations and residencies for the students. I'm happy to let you know that not only do we have that, we had an overwhelming agreement and need from Sparks Hospital, Mercy Systems, Cooper Clinic, Community Health Centers of the state of Arkansas, and the Choctaw Nation of Oklahoma, all of which have agreed to take our clinical rotations and resulting residencies of these students. Over 70% of the students where they share their residency is where they end up calling home. Over 60% of osteopathic medical doctors end up in primary care. Primary care is one of the nation's crises that we live in today. The estimates from the government are 140,000 doctors short by 2030. That's only 16 years away. If we have the full implementation of the Affordable Care Act, that number will blossom to 250,000 doctors short in the United States. When we looked at this from a feasibility, from an economic standpoint, one of the determinations of that was being able to recruit in the type of teachers, physicians, PhDs, or terminal degreed individuals. There will be 65 of them employed here. The average salary is $103,000. That does not include the 30% that we've built in for fringe benefits. Economic impact that we have seen just on the medical school alone ranges between $75 million and $100 million annually. I realize that's a huge economic impact to this region, but you must understand from our foundation standpoint, what we were looking to do was fulfill a need. And we saw a healthcare crisis. And that's why we decided to start out with the medical school, which sits right here. That's a 60,000 square foot building. That would be the minimum size that we'd build that building. What you see are adjacent buildings that sit around that. What we fully anticipate doing is continuing to build out a medical university. We will look at a dental school, a physician's assistant school, physical therapy schools, all of which will be determined by the needs in these communities as what the greatest need is at that point in time. So that's what this top area is. What you're seeing here are supplemental buildings, such as would be some housing for our students to go in, some mixed uses for support necessary. I assume that they'll eat some food if they're not studying from time to time, and things like that. So you'll see that over on what's really the Barling side. Basically, Chad Colley Boulevard, you have Fort Smith off to our left on this chart, and you have Barling down in here to your right. Buffer zones are built in because we want to have an entire university atmosphere and look, and we want to be able to make sure that we maintain the credibility of a medical university. I would anticipate that certainly during our lifetime, you will see a lot of building in this university environment that's going on here. How fast that gets built is determined solely upon the needs and obviously some of the financial impact that we can bring together as a foundation. This morning, as chairman of the board, the Board of Trustees voted. We are committing $58 million to this project coming out of our foundation. We're obviously going to be looking for additional partners to continue the build out of this, but we are committing $58 million towards this project. Any questions? Thank you.
Tom, is there anything you want to add to that before we go?
The one thing that I always like to add, whenever given the opportunity, is I sit with these 8 trustees, and every meeting they go to as executive director, and they are truly mission-driven people. This whole project is not about the money, it's about the people. It's about meeting the needs of people. And I believe that you will see our foundation continue to follow that path, that the needs will create the activity. And there's obviously significant needs in the area, but I think the main thing is the mission drives the outcome.
Well, after hearing that presentation, the Real Estate Review Committee had some discussion. We're talking about 200 acres, which is valued at roughly $4 million. We had discussion about utilities and all other issues regarding it, and the committee voted to recommend that we convey 200 acres, as shown on the map there, to the Fort Smith Regional Health Foundation.
Okay. All right. We have a recommendation from our Real Estate Review Committee here, and we want to present that to the full board. So I consider that to be in the form of a motion. I would entertain a second. Second. All right, Chuck, thank you for that second, and we'll entertain any other questions or thoughts the board might have.
I just have one thought.
Okay.
Wow.
Wow. We had during the Real Estate Review Committee meeting, we had a lot of information given that Kyle didn't share with us at this time, but it's overwhelming to see the impact that this could not only have initially, but in the next generations to come. And so it certainly is an exciting adventure to be a part of.
Dean, before we go, Kyle, do you want to speak to the schedule?
Certainly, I'd be glad to do so. The board also authorized me to begin looking for a chief executive officer and what's called a chief academic officer. The chief academic officer is the male or female that holds that position, is the one that sets forth the curriculum inside of the proposed college. And upon hiring that person, which we anticipate to be around July the 1st for the chief academic officer, we, by rule of the national accrediting body, must wait 6 months from the time of that hiring until you file what's called a feasibility study. In that feasibility study will be things such as the size of the building that you're going to build, the curriculum that you're going to take, the processes for your clinical rotations, your residency requirements and whatnot. It's mostly an academic-driven model of feasibility. Once that is submitted, then you go in this national accrediting body, its acronym is COCA, C-O-C-A. And COCA will then review your feasibility, determine if there's additional comments that they would like to make, which we would certainly anticipate they would do that, as they most generally do. And then we would then go through, make some modifications or changes. Most of those are when you're hiring certain people to do certain things. And then our first class will come in August of 2017. That will be the inaugural class of 2017. One of the questions that was asked to me in the other meeting was, are you going to have any problems getting the students? National averages right now, whether it's MD or DO schools, 2,500 applications per one seat available in a medical school. We don't think we're going to have any issues trying to fill out doctors in these young people that come in. And remember, these are not 21 and 22 year olds that are coming in. They may be 21 or 22 when they come in, but when they step out of this medical school and get through their residencies, they're 26, 27, 28 years old. That's why you can see that over 70% end up locating where they've done their residencies. So obviously, as I said, we understand the economic impact, as Tom did. But to us, it's not about building a school. It's about fulfilling a mission. And so we're very excited that Fort Chaffee is moving forward with us as partnership on this project. Thank you.
All right. Any other questions, thoughts? If not, I'll call you to vote. All in favor of this conveyance of the 200 acres, let it be known by saying aye.
Aye.
All opposed? And that motion passes. I think that deserves an applause. Ivy, would you like to say anything?
Of course.
Put you on the spot.
We will, once we leave here, we'll be going over to the Nature Center for the official press conference, and there will be time for interviews over there. That starts at 4:30. I want to say what a experience. I start to say pleasure, but what an experience it's been working with these two guys and their staff through this sequential steps we had to take to get here. I've learned a lot about what goes on, and besides what I've always heard, what goes on in starting a medical school. I've learned that they are committed, and I'm convinced that they are mission-driven as we are. This fits perfectly in our land reuse plan. It's right over, it dovetails what we're trying to do here. And the impact of this, besides the $75 million a year on the community, is just immeasurable in my opinion. So I think we're in for a nice ride over the next 4 or 5 years.
Well, I know the staff here has done a lot of work behind the scenes that the board hasn't seen. And you guys, you know, for us to give away $4 million worth of land doesn't come easy. We have to think long-term, and we expressed that concern, and I know our staff has done a good job in making sure that that doesn't hinder our view and our future here at Fort Chaffee. So I thank you for that. And I know our two mayors that are representing here, they may look at that mission statement. You guys are probably concerned about like the economic outcome that will come.
Doesn't sound bad at all.
Yeah, not bad. All right. Nothing else to come before this special meeting of the board. I'll consider us adjourned.